Marvin, the mayor, has sort of set out a challenge really. If they're going to build 2,000 houses a year in Bristol, plus we've got housing growth around outside the Bristol area, but in the Bristol region, really the challenge is how can we build that in a more healthy way, to have people in the room who just want to enter into that debate.
So there's a lot of expertise in Bristol, there's a huge amount of research going on in our academic institutions, there's a lot of enthusiasm and will to do things a bit differently in Bristol as well. It's that kind of place. So we're hoping to harness all of this together tonight, bring it together and see how we can take the housing agenda forward in a new and more interesting and different way. I was very excited when Marcus mentioned this event because it's exactly the kind of gathering we want to get the conversation going. None of us can do this on our own, the council can't do it on our own, developers can't. We all need to work together to try and build this health into our building programme because we can't afford not to. We can't risk the health of people 20, 25 years down the line to have huge both financial costs for the NHS and other state interventions, and also just on a personal, social and ethical level we can't afford it.
And according to the King's Fund, high standard spatial planning can result in £50 to £168 benefit for every £1 spent on interventions that promote walking, cycling and insulating homes. So when it comes down to the detailed figures, designing communities for health makes sense financially, and it's not a special endeavour, it's just good design.
The broad consensus, of course, is to keep the shining jewel, the NHS, free at point of delivery. And that cuts across, political parties, it cuts across everyone. It binds people together from all walks of life. Yet year on year, this financial burden increases. And there is absolutely irrefutable evidence now that shows a significant, I'm using that advisedly, amount is spent on treating individuals with avoidable illnesses, with problems whose source is not the individual, but the urban environment, the habitat, the human habitat in which they live.
We're not seeing large £300 million hospitals like you've got in Bristol coming downstream. We're seeing a transition into pushing forward, creating environments that support well-being.
It is all about a commercial system. And then how do we bring the public, private and third sectors to work together to create places that are thriving communities for the benefit of us all and get health into our communities and out of the hospitals?
The short-term thing is you've got to jump onto any opportunities to challenge the way in which decisions are made and to try and incorporate a consideration of health outcomes and their longer-term benefit into decision-making.
We do not think about medium to long term, and we do not create the context for that. We blame politicians, but politicians only have a certain time frame that they can work within.
I would actually like to see more asset transfer of land to local communities so that we get the ownership of the land. That takes out the land value issue that was being talked about earlier, and just means that whatever we develop there's a long-term interest, and the profit and some of that profit can remain locally within local communities.
I think if you empower communities to shape their own destiny, their own future, as it were, then they're going to have, you're going to get development that actually meet their needs.
I think if we continue to build more hospitals, we're just on our hiding to nothing. We've got to re-engineer the way that we deliver, well, not just deliver healthcare, but the way we are well and promote well-being in our communities. And this needs, a coalition of designers, policymakers and communities to really work together to solve these issues. And hopefully we can bring an evidence-based approach to this so that we know that the proposals and ideas we're bringing forward are really going to make a material difference and improvement to the health and well-being of communities.